Hello everyone, my name is Kristen McPhee. I'm a nutritionist and clinical herbalist in Marquette, Michigan, and I wanted to spend some time today providing some self-care tips for acute bladder infections, otherwise referred to as acute cystitis. And acute bladder infections are generally uncomplicated infections that occur 1 to 2 times per year, and when they do occur, they last less than 1 week in otherwise healthy women. And the symptoms would include things like frequent urination or an urge to urinate, even though your bladder may be nearly empty, and then just discomfort in the pelvic area, such as pressure, pain, achy, crampy, and all of these symptoms would come on suddenly. So, those are general symptoms of an acute bladder infection. And they occur mostly because of E. coli from bowel flora. That's in 80 to 90% of cases is due to E. coli. Other factors that can cause a bladder infection is sexual intercourse, STDs such as chlamydia, gonorrhea, herpes, as well as candida. And it does affect some individuals more than others. The primary group would be sexually active heterosexual women, and if they're using oral contraception, spermicides or a diaphragm, that can drastically increase the risk of getting a bladder infection. And it does help if you are sexually active just afterwards to go to the bathroom, so you're flushing out your urinary tract and just offering good proper hygiene. The other group that are affected is postmenopausal women, and that's because postmenopausal women often have a lower estrogen, and that affects the vaginal and bladder microflora. And they may also have a weaker bladder that's lost some tone, or the lining isn't as supple, and so E. coli would be more likely to bind to the bladder lining, or if they have a catheter. So postmenopausal women, sexually active heterosexual women, those are at higher risk. And also pregnant women, just because they're experiencing hormonal changes naturally, but those hormonal changes can also alter vaginal and bladder microflora. And then any female that's had long-term antibiotic use is also at risk. So the goals of self-care, as well as working with a holistically minded practitioner, would be to reduce the duration of the symptoms, reduce or prevent progression to the upper UTI, so preventing the spread, and then preventing the overall reoccurrence of infection. And just general nutrition guidelines would be to have a low sugar diet, that when you do consume carbohydrates, that they're complex carbohydrates high in fiber to support your GI, and including healthy fats, and also just making sure you're staying hydrated and aiming for at least 2 liters of water a day. And then things that in your diet that can trigger a bladder infection and make symptoms worse is soft drinks, higher sugar fruit drinks, coffee, and alcohol. And foods that are really good for preventative measures are any sort of fermented dairy product that has lactobacillus in it, and an example of that would be kefir. Garlic and onions are really wonderful too because they're naturally antimicrobial, so that can help ward off infections. Then there's some specific nutritional supplements I would recommend. They can be applied both as a preventative measure and during acute onset. And obviously, when you have the onset of an infection, you would want to increase the frequency and dosage versus when it's just for day-to-day prevention. So the first one most everyone has heard of, it's cranberry. And cranberry reduces the ability of E. coli to adhere to the bladder and urethral endothelium. So that can drastically reduce the likelihood of having reoccurring infections. And you would want to drink the unsweetened juice. 16 ounces per day is ideal at the onset of infection. If you don't like the taste of unsweetened cranberry juice, you can do extract in capsule form, and that would be 400 milligrams 3 times daily during acute onset. And that can be a little bit more cost effective as well. Blueberry juice works just as well as cranberry juice too. So if you want to stick with juice and you don't really love unsweetened cranberry, you could find a unsweetened blueberry juice. And then the next one is probiotics, and that's just because the bowel flora, an imbalance of bowel flora, and a higher increase of E. coli is the primary contributor to bladder infections. So if you work on correcting your bowel flora, that can often be a great preventative measure for bladder infections. You can take them as suppositories and orally, and the strains you want to look for are the lactobacillus strains, specifically rhamnosus and reuteri. And you would want to have a dosage of at least 24 CFUs per day during an infection. So probiotics are great, cranberry is great. The other one is D-mannose, and that one is the naturally occurring simple sugar that is in cranberry juice. But if you take it as a supplement on its own, then you're getting a higher dose of the simple sugar that can help prevent infections. And that is just a powder. You would want to take 1/2 to 1 teaspoon 3 times per day at onset, and a lower dosage as preventative. And there has been some research on the effects of vitamin C. We know that vitamin C helps support our immune system, but it may also help because it's ascorbic acid, so it's acidic naturally. It may help normalize the pH of the bladder and help to ward off an infection in that way. And a standard dose would be between 500 to 2,000 milligrams every 2 hours for 48 hours at onset, and then you could reduce based on how your symptoms are after that. And there's some really wonderful botanicals that you can apply to acute bladder infections. They're best used at the onset of an active infection instead of a preventative measure. And you can take them up to every 2 hours, and it may improve the duration, so the infection may subside within 24 hours instead of lasting a full week. And it may help manage symptoms so you're more comfortable. The ones that you want to look for are uva ursi, and that one's really well known because it's antiseptic, antibacterial, astringent, and also a diuretic. And that is because it has this active constituent called arbutin. So it's really appropriate for bladder infections due to its actions in arbutin content. It's best used in combination with other herbs, and it's not intended for long-term use or at high dosages. And it hasn't been proven safe for pregnancy, and they're not sure if it's safe for lactating women. So don't use them in those cases. And as a single herb, it can be irritating and inflammatory, so you would want to combine it with something that was kind of cooling and soothing, like marshmallow or corn silk. Those are natural demulcents. And also combining with a diuretics like dandelion leaf would be really great. And there's another herb that has similar actions to uva ursi and is also high in arbutin called pipsissewa. So look for uva ursi, pipsissewa, corn silk, marshmallow, dandelion leaf. Those all in combination would be really helpful for acute bladder infections. And then the other ones are the herbs that are high in berberine, and those tend to be very wonderful as a broad antimicrobial. And examples of those are golden seal and Oregon grapefruit, and those are safe in appropriate dosages, except they haven't been proven to be safe for pregnant or lactating women. And so those are my top tips. I also just wanted to point out that it's wonderful to have some knowledge on how to do simple self-care through nutrition and herbs, but I think in certain circumstances it's also appropriate to seek out some professional supervision by a practitioner or herbalist, nutritionist, whomever that may be for you. And that's just because you want to make sure that you have a proper diagnosis and you really understand what's going on before you integrate interventions. So For example, STDs and Candida can influence bladder infections, but they can also cause acute urethritis. And so you want to make sure that you're certain that it's just an acute bladder infection and not one or the other or both of those symptoms if you do have a history of Candida or STDs. There's also a more chronic bladder disorder called interstitial cystitis, painful bladder syndrome, and that is not caused by an infection, which differentiates it from an acute bladder infection, but oftentimes symptoms are very similar. And this, because it's a chronic